Marie Kingsbury. I'm an HR advisor, and today has been just absolutely amazing. The kids are really interested in the displays. They really enjoy the tactile equipment that we've got and being able to try things out. And if it plants a seed in their mind about the variety of options and careers in health, it's really great.
One of the senior nurses in the emergency department here at Gisborne Hospital. We've been doing interactive IV cannulation with the students, and they've just been absolutely adoring it. Some very good techniques from some of these young students. Naturals. We need to train the young ones, coming up.
I'm Natasha Wānua. I'm a year 12 student at Te Haoura Tairawhiti School. My experience so far has been great. I've learned a lot of information, and I've learned about a lot of job opportunities that I never expected to be in the health industry. It's mind-blowing to know how many opportunities there are for Māori. Just anything in general, you can tie it back to health. It's really cool. I'm really interested in psychology now. After hearing about what you actually do as a psychologist and all the pathways you can take, it's really grabbed my attention.
I love patient contact and being with patients every day and being with different people every day and awesome people and their babies. It's always generally for a happy cause. I started out by going to UCOL in Palmerston North and studying my general X-ray. So I started off by doing that's a 3-year degree, doing a lot of study at the university and a lot of placement here in Gisborne. Forced my way into getting a job here in ultrasound, which is another 3 years study on the job through a university in Sydney.
I'm a second year student midwife. Training through WinTech, but we're based here in Gisborne for most of our practical experience.
Well, my role is that I'm actually a project manager in the hospital, and get lots of experience doing different things in the hospital, and then they can decide to go and do post-grad study and specialise in different things that are available in nursing.
My name's Stu Potter. I work for Tairawhiti District Health. My role here is Group Manager of Human Resources. I see today as being hugely successful. Having 170 students, we've got a lot of health practitioners, as you would have seen in there too, sharing their stories, they're sharing their the positive energy with our students coming through. Some of our students go away today to talk about their experience with their families and make health a career choice. Probably not so unique to Gisborne, it's probably national skill shortages. We call them vulnerable workforces. And the major groups at the moment that we're struggling with around mental health occupations. We're also struggling with midwives and some of the specialty areas in medicine. And I think one of the big pluses about today is the partnerships that we've been able to develop. So we couldn't have done this without Careers New Zealand and also working with our other health providers. So we've got Ngati Porou Hauora here today and Turanga Health.
I'm the CEO for Turanga Health. Our investment in this is basically we see a pool of talent with rangatai within Gisborne, and so we want to share in their potential progress, be it globally or internationally. And with any investment, we might attract 10% of them to come back to Gisborne and assist us in our endeavours and sharing the load around the work that we carry. So, we've got a vested interest to make a difference.
I'm Steve Couchman. I'm the pilot here flying for ECT Rescue. So today we've had young people looking at careers, and we've had them come down here to the base, and that's part of our involvement with the community here to show young people different options of what they can do, in this case within the health care system, because we are part of that.
My name's Dan. I'm an emergency medical technician in Gisborne. This is the oxygen level inside our blood. So our patients need to be anything from 94% and above. I found that they were more interested in the stretchers and the equipment, how it worked and what it did. A lot of them would get on it and strap in and have a feel about what it feels like. You've got to finish school, especially that's the message for today's group because they're all school kids. I really recommend coming on board as a volunteer, doing some events, doing some road work and seeing if you like it. It's not for everyone. Some jobs knock other people different ways. So, I recommend experiencing it first.
My name's Renee Hatton and I go to Camping College and I'm year 12. And today we've been able to see all these different career paths that we can go down. There's so many different options that, in health that we haven't even been exposed to before. So it's been really interesting to learn about all these different areas. I'm looking at either nursing or going to med school. But it was really interesting just learning about all the different things in the community that are out there as well.